Ignoring the body signals can be costly, especially when it comes to something as serious as prostate cancer. This is a condition that affects thousands of men every year. Often silently recognizing early symptoms and acting quickly can make all the difference in this video. You'll find essential information to better understand how your body communicates when something isn't right. Protecting your health is a priority, and staying alert to the signs is the first step to ensuring a future with better quality of life. After all, every right choice you make today directly impacts your well-being tomorrow. Before continuing, make sure you're subscribed to the channel so you don't miss more tips on health and sexual education. If you enjoyed this content, like the video and share your thoughts in the comments. Type 1 if you approve of the topic, or 0 if you have suggestions for improvement. Your interaction makes all the difference. Number 1, getting up multiple times at night. Have you noticed you're waking up more often during the night to go to the bathroom? It might seem like it's just because you drank too much water before bed, or chalk it up to aging. However, for men over 50, increased nighttime urination can be a sign of something more serious. When the prostate begins to enlarge, it can press against the urethra, the channel through which urine flows, making it difficult to fully empty the bladder. This creates a constant sensation of needing to go again. This symptom, called nocturia, often comes with others, such as a weaker urine stream or sudden stops in the flow. What used to be a peaceful night can turn into interrupted sleep, leaving you tired and irritable during the day. Imagine trying to keep up with daily activities without proper rest. Interrupted nights affect your mood, concentration, and even simple tasks. What's even more concerning is that this sign is often overlooked, delaying the diagnosis of more serious conditions, like prostate cancer. Of course, frequent urination isn't always a serious issue. It could be caused by an infection, diabetes, or even dietary habits. But if it's happening regularly, it's a signal that shouldn't be ignored. Consulting a doctor is essential to understand the cause of the discomfort and take action if necessary. When prostate cancer is detected early, the chances of successful treatment are excellent. Pay attention to your body changes in urinary habits may be a sign that it's time to take better care of your health. Make it a priority, and the rest will fall into place. Want to improve your sex life and strengthen your relationship in the digital book? Rediscovering Intimacy, Healthy Sexuality After 60, you'll find practical strategies to reignite desire, overcome challenges, and deepen your connection. Check the link in the pinned comment and take a new step in your love life. Number 9, difficulty starting to urinate. Have you ever had that moment in the bathroom where it feels like your body needs a little push to get things going? This might seem like a passing issue, but when it becomes frequent, it's a sign that requires attention. Difficulty starting the urinary flow, known as urinary hesitation, is often linked to prostate enlargement, a common issue in men over 50. Imagine the prostate as a small valve around the urethra. When it grows, it can press against this channel, making it harder for urine to pass through. The result? You spend more time in the bathroom, straining your abdominal muscles, and feeling like something is blocking the flow. This situation is not only uncomfortable, but can also lead to complications, such as urinary infections and bladder stones, as leftover urine can accumulate and cause problems. Additionally, urinary hesitation doesn't just affect the body, it impacts the mind as well. Think about how frustrating it is to be in a public restroom, in a hurry and unable to go. This discomfort can cause many men to avoid certain social situations, limiting their routine and quality of life. The key is not to ignore these signs. Sometimes this difficulty might be due to a less severe condition, such as benign prostatic hyperplasia, but it could also be an early symptom of prostate cancer. And here's the good news: early diagnosis makes all the difference. When caught, early treatments are more effective and have a smaller impact on overall health. Pay attention to your body signals and see a doctor if you notice changes like this. Taking care of your urinary health is essential for ensuring well-being and maintaining a good quality of life. Number 8, feeling that the bladder is never completely empty. Have you ever left the bathroom feeling like you didn't fully empty your bladder? This might seem harmless or like a temporary discomfort, but for men over 50, it can be an important symptom related to prostate health. When the prostate enlarges, whether due to benign causes or more serious conditions like prostate cancer, it can compress the urethra, making it harder to fully empty the bladder. This leads to more frequent trips to the bathroom, yet still feeling like something is stuck. The impact on daily life is significant. Sleep is often interrupted, and the constant need to urinate interferes with simple activities like watching a movie or attending meetings. Frustration builds, and many men begin to avoid certain situations, like long trips or social events, out of fear of not having a restroom nearby. It's not just about discomfort when urine isn't completely eliminated. It creates an environment ideal for bacteria to grow, increasing the risk of urinary tract infections. Additionally, the pressure build-up in the bladder can lead to pelvic or lower back pain, worsening the problem. Although this symptom is common, many men hesitate to seek help, thinking it's just a normal part of aging. The truth is that the sensation of incomplete emptying can be one of the first signs of early-stage prostate cancer or other conditions that require attention. If you notice changes in your urinary patterns, consult a doctor. Simple tests like a PSA test and an ultrasound can identify the cause and help prevent more serious complications. Don't ignore the small warnings your body gives you. Taking out action early makes all the difference in quality of life. Number 7, burning or pain while urinating. Feeling pain or a burning sensation while urinating, known as duria, is something that should not be ignored, especially for men over 50. While it is often mistaken for a urinary tract infection, this discomfort can be a sign of prostate issues. When the prostate is inflamed or enlarged, it can compress the urethra, causing irritation and leading to this uncomfort-able sensation. This pain may occur at the beginning or end of urination, as if the urinary tract is irritated despite seeming like a minor symptom. The impact on daily life can be significant. Imagine dealing with this discomfort repeatedly throughout the day, creating anxiety or even fear of using the bathroom. This kind of persistent discomfort can subtly but steadily affect quality of life. Additionally, when the bladder isn't completely emptied, something common in men with prostate issues, residual urine can further irritate the urinary tract and increase the risk of infections over time. This cycle of discomfort can worsen the condition. More concerning is that in some cases, pain while urinating can be one of the first signs of prostate cancer, especially if it is accompanied by other symptoms, such as blood in the urine or increased urinary frequency. Seeking medical help at the first sign of these symptoms is crucial with simple tests like a PSA test and an ultrasound. The cause can be identified and treated appropriately. Don't ignore your body's signals. They are valuable warnings to help you preserve your health. Number 6, pain in the pelvic region back, or hips, that nagging pain in the back. Hips or pelvic region might seem common, especially as the years go by. Often we attribute such discomfort to aging or poor posture. However, when this pain persists or worsens, it could be pointing to something more serious like prostate cancer. This pain may start subtly, almost as a discomfort that comes and goes over time. However, it can intensify, becoming constant, or appearing in episodes that interfere with daily activities. Why does this happen when the prostate enlarges or cancer begins to spread? It can press on surrounding nerves and tissues, causing persistent pain in advanced cases. When cancer spreads to the bones, the discomfort can become even more severe. Now imagine how this impacts daily life. Simple activities like walking, sitting, or even sleeping can become real challenges. Constant discomfort affects mood, sleep, and energy levels, disrupting the ability to perform routine tasks. It can significantly diminish quality of life. Another important point common muscle or joint pains usually improve with rest or a pain reliever. However, if the pain persists or worsens, it's a red flag that shouldn't be ignored. Unfortunately, many men only seek medical help when the pain becomes unbearable, which can indicate a more advanced stage of the disease. The good news is that seeking medical attention early can make these pains a valuable indicator for early diagnosis tests, such as X-rays, MRIs, or blood analyses, can help identify the cause and determine the best course of treatment. Don't ignore your body's signals. Take care of your health and schedule a consultation. If you notice persistent pain, prevention and early diagnosis are always the best allies. Number 5, weakness or numbness in the legs. Feeling weakness or numbness in the legs might seem like a minor issue, perhaps caused by poor posture or fatigue. However, when these symptoms persist or intensify, they could indicate something more serious in advanced cases of prostate cancer. This condition occurs when the disease spreads to the bones or presses against the spinal cord, illustrating how interconnected our body truly is. Imagine a mild tingling sensation that starts after sitting for a long time over days. It evolves into difficulty climbing stairs or walking long distances. This discomfort may progress to a loss of muscle strength, making basic tasks that were once effortless feel challenging. This change can cause frustration and even anxiety, as its direct lie impacts mobility and independence. This symptom often doesn't appear alone. Leg weakness is frequently accompanied by lower back pain, difficulty urinating, or a feeling of pressure in the pelvic area. These combined signs suggest that an enlarged prostate or cancer may be compressing nerves or blood vessels, essential for movement and leg sensitivity. It's important to note that in severe cases, spinal cord compression can lead to more serious consequences, such as partial or total paralysis of the legs. Therefore, do not ignore weakness or numbness. Seeking medical help promptly is crucial to avoid permanent complications. Tests like MRIs or CT scans can help identify the root cause, while targeted treatments such as medication, physical therapy, or even surgery can provide relief and restore quality of life. When diagnosed and treated early, even advanced cases can be effectively managed. Number 4, unexplained weight loss. Unexplained weight loss is something that warrants attention, especially for men over 50. This symptom can be related to advanced stages of prostate cancer and signals that the body is dealing with a significant issue. As cancer progresses, it impacts metabolism, forcing the body to expend more energy to fight the disease. Additionally, hormonal changes can reduce appetite or make eating difficult. Many men only notice the impact when the weight loss becomes significant, often accompanied by other symptoms such as extreme fatigue or muscle weakness. This unintentional weight loss can also take an emotional toll. Imagine the concern of watching your weight drop without understanding why, leading to anxiety and worry, can disrupt daily routines, work, and even family moments. While other conditions such as metabolic or gastrointestinal issues can also cause weight loss, it should never be ignored. Seeking medical attention when you notice this change is essential. Tests such as blood analyses, ultrasounds, and other imaging can help determine the cause and guide the most appropriate treatment in cases of prostate cancer. Treatments such as chemotherapy and radiation therapy can help control the disease and improve quality of life. Nutritional guidance may also be necessary to ensure the body receives essential nutrients during treatment, helping to restore energy and health. Do not underestimate your body signals. They are important alerts for your well-being. Number 3, persistent fatigue, feeling constantly tired, even after a good night's sleep, is not something to ignore. This persistent fatigue can be a sign that the body is dealing with something more serious, such as advanced stage prostate cancer, when the body is battling a disease. It uses more energy to function, which can leave you feeling drained. even for the simplest tasks. This extreme fatigue is often linked to anemia, a reduction in the number of red blood cells, which is common in cancer patients, with less oxygen being transported through the blood. The body loses energy quickly. Simple activities such as climbing stairs or walking can become significant challenges, directly affecting daily routines and quality of life beyond the physical effects. Fatigue can impact mental health. Constant lack of energy can lead to discouragement, affect work limit, social interactions, and even cause symptoms of depression. This cycle of fatigue and lack of motivation affects both the body and the mind, making daily life even harder if you've noticed this change. It's important to see a doctor. Simple tests such as blood analyses can help identify the cause of the fatigue and guide the best treatment in cases of prostate cancer. Managing the disease can significantly reduce fatigue. A combination of medical treatment, a proper diet and light exercise, such as walking, can help restore energy and improve well-being. Paying attention to your body and taking action early makes all the difference for your health. Number 2, urinary infections that keep coming back when a man begins to experience frequent urinary infections. It's time to pay attention. Unlike women, men rarely deal with this problem, making recurring episodes a potential warning sign of prostate issues. These infections usually occur because the bladder cannot empty completely. The accumulation of urine creates a perfect environment for bacteria to thrive, resulting in symptoms such as pain or burning during urination, a constant urge to go to the bathroom, and in more severe cases, fever beyond the physical discomfort. This situation can interfere with daily commitments, travel, and even leisure moments, impacting quality of life. Recurring urinary infections can also point to more serious problems when the prostate is enlarged or in advanced cases of cancer. Urine retention becomes more frequent, promoting bacterial growth and complicating the situation further. Ignoring these signs could delay an important diagnosis if you notice repeated urinary infections. Consult a doctor. Diagnosis typically involves urine analysis and imaging tests to identify changes in the prostate or urinary tract. With proper treatment, the discomfort can be managed. Antibiotics are used to combat infections, and when necessary, procedures may be performed to address the underlying cause, such as prostate enlargement. Additionally, simple measures like drinking plenty of water and urinating regularly help prevent new episodes. Early diagnosis and continuous monitoring are essential to avoid complications and maintain good health. Number 1, blood in urine or semen. Noticing blood in your urine or semen requires immediate attention. Even if it seems minor or appears in small amounts, this symptom can indicate significant changes in the prostate, including cancer, whether it's a slight reddish tint or visible spots. Any such sign should be taken seriously. Blood in the urine, known as hematuria, is often associated with urinary tract problems, such as inflammation, infections, or an abnormal enlargement of the prostate. Blood in the semen, called hematospermia, is less common but can also indicate similar conditions. These signs are often accompanied by other symptoms, such as pain during urination or discomfort during sexual activity beyond the physical impact. The emotional toll is significant. Noticing blood in such intimate moments can cause fear and anxiety, leading many men to delay seeking medical help. However, the sooner the cause is identified, the greater the chances of effective treatment. Prostate cancer, when diagnosed early, has high cure rates. Urine tests, PSA screenings, and imaging exams help identify the source of the problem. Treatment depends on the cause. Infections are typically treated with antibiotics, while cancer cases may require surgery or radiation. Therapy. Don't ignore your body's signals. Acting early makes all the difference for your health and well-being. Now that you know the signs, it's time to think about prevention. While it's not entirely possible to avoid cancer, adopting healthy habits can reduce risks and contribute to long-term health habit. 4. Eat smart. Adopting a healthy diet is essential to reducing the risk of diseases, including prostate cancer. Foods like fruits, vegetables, leafy greens, and whole grains provide vitamins, minerals, and antioxidants that help protect the body cells from damage caused by free radicals. These nutrients strengthen the body and promote balance. On the other hand, avoiding ultra-processed foods is equally important. Products high in saturated fats, sugars, and chemical additives increase inflammation in the body and promote weight gain, creating conditions that can lead to disease development. Replacing these foods with natural options is a simple but highly significant change. One example is breakfast swap. Refined bread for whole grain options include fresh fruits, and choose unsweetened natural yogurt to sweeten beverages, or recipes opt for honey or coconut sugar. Instead of refined sugars, these small changes can make a big difference in the long run by prioritizing a balanced diet. You not only strengthen your body, but also improve your quality of life. Every dietary choice is an opportunity to care for your health and prevent future problems. Habit 3. Get moving. Maintaining a routine of physical activity is one of the best ways to take care of your health, including preventing prostate cancer. Simple activities like walking, swimming, or even dancing help improve circulation and strengthen the immune system. You don't need to be an athlete. The key is to keep your body active consistently. Exercise is also a great ally in weight management. Obesity is linked to inflammatory processes that can increase the risk of various diseases. Combining physical activity with a balanced diet is crucial to maintaining a healthy weight and protecting your body. The positive impact extends beyond physical health. Exercising reduces stress, improves mood, and enhances sleep quality. Activities like yoga, stretching, or even jumping rope can be done at home and help balance mind and body. Finding something you enjoy is essential to making this habit part of your life. If you're just starting, respect your limits, start slowly, and increase the pace as your body adapts. Consulting a doctor or professional before beginning a new routine is always a good idea, especially for those with pre-existing health conditions. Getting your body moving is a direct investment in your well-being, providing more energy and vitality to make the most of each day habit. 2. Reduce or eliminate alcohol and smoking. Excessive consumption of alcohol and tobacco is directly linked to numerous health problems, including an increased risk of prostate cancer. Smoking exposes the body to chemicals that can cause genetic mutations, while excessive alcohol drains the liver and disrupts hormones, essential for prostate health. Making changes to these habits brings nearly immediate benefits. Quitting smoking, for instance, improves circulation and strengthens the immune system within a few weeks. Reducing alcohol consumption helps the body regain energy and improves the functioning of organs, like the liver and kidneys. Moreover, giving up these habits positively impacts mental health. Many men report feeling more confident and motivated, which reflects in their personal lives and social relationships. This positive effect can even inspire friends and family to adopt healthier habits. Small changes such as replacing alcohol with natural juices or teas and using nicotine gum to manage cravings can make the transition to a healthier lifestyle easier. Seeking support, whether in groups or through therapy, can make a significant difference in this process. Remember, it's never too late to start. Gradual reduction is already an important step toward better health and improved quality of life. Habit 1. Make routine exams. A priority, undergoing routine exams is essential for the early detection of prostate cancer and other serious conditions. Tests such as PSA, which measures a protein produced by the prostate, and the digital rectal exam, which is quick and painless, are indispensable tools for assessing prostate health. Men over 50 or 40, if there is a family history, should regularly consult a urologist. Early detection can prevent complications and significantly increase the chances of effective treatment. Additionally, complementary exams such as ultrasound or biopsy may be recommended if any abnormalities are identified. Overcoming the stigma associated with these exams is an important step. Taking care of prostate health not only saves lives, but also provides peace of mind. Knowing everything is in order reduces anxiety and allows for quick action. If needed, openly discussing the topic with friends and family is another way to break taboos and encourage more men to prioritize their health. Prevention starts with awareness. Make routine exams a commitment to yourself. The first step toward a long and healthy life. The body's signals are valuable. Warnings that, when ignored, can be costly in this video. You've seen how seemingly simple symptoms, such as changes in urinary habits or persistent pain, can indicate something more serious, like prostate cancer. Prevention and early detection are essential to preserving health and quality of life. Now it's your turn. What habits have you already adopted to care for your prostate health? Share your answer in the comments like this video to help spread this important information to more people. Your like is essential to strengthen our channel and continue bringing relevant content. Explore other videos on our channel about health and sexual education. For men over 50, discover tips that can transform your routine and improve your well-being. Take care of yourself, and see you in the next content.